we have preliminary cohorts. We are speaking about of less than 200 patients divided in the different subcategories I presented you. Once we do detect specific autoantibodies in the serum or in the CSF, then we can go for the specific antigen targeted by these antibodies. So it's a long, long way, but still, once we have identified a promising group of patients with clinical lab testing that has a highly propensity to have autoantibodies, something that is interesting, definitely, we can go for antigen discovery. Once we do have this CNS antigen, it's easily, we can make cells to express this antigen. And then having this antigen overexpressed in the cell line, you can easily transfer this tool into a diagnosis. And this can help in determining whether the antibody is present in a large scale type of patients and help into dividing the patient in clinical practice. So then, of course, if the antibody will be targeting surface antigen, it will be also interesting because it helps in determining the clinical practice, the clinical approaches, immunotherapies, etc. Contrary to intracellular antigen that can be targeted by antibodies, this definitely will be a diagnostic tool, but also help in determining the profile of treatment that I use in the patient for the clinicians. Yeah.